Breast cancer. What to hope, how to cope. Conchita had none of the classic risk factors. She was 40 years old, healthy, and had no family history of breast cancer. Her regular mammogram had shown nothing abnormal. But one day, while examining her breast in the shower, she felt a lump. It turned out to be cancer. Conchita and her husband sat numbly while the doctor explained her options. Now, in times past, a doctor would tell a woman with breast cancer that her only hope lay in the radical mastectomy, a disfiguring operation that removes the breast, lymph nodes in the chest and armpit, and chest muscles. Chemotherapy or radiation treatments often prolonged the ordeal. Understandably, many dreaded the cure more than the disease. The battle against breast cancer has been an ongoing struggle between the need to treat a killer aggressively and the desire to avoid needless disfigurement and painful side effects. Like Conchita, today's breast cancer patients may have a range of treatment options, and a steady stream of medical studies and media reports hold out hope that breakthrough treatments, predictive tests and protective diets will finally conquer the disease. Despite medical advances, however, breast cancer remains a leading cause of female cancer death. The industrialised countries of North America and Western Europe have high incidences of cancer, but numbers are rising in Asia and Africa, which have historically had lower incidences. Moreover, death rates among those diagnosed in Asia and Africa are higher. Why? Well, early detection is negligible, said a doctor in Africa. Now, most patients come to us when they are already in an advanced state. Risk increases with age. Some 80% of cases are in women over 50, but the good news is that breast cancer is one of the most treatable cancers. Indeed, 97% of women where early stage breast cancer is localised are still alive 5 years after diagnosis. Conchita recently passed the 5-year mark. As in Conchita's case, breast cancer is often detected as a strange lump. Fortunately though, about 80% of such lumps are benign or self-contained, many simple being fluid-filled sacs with cysts. Now, breast cancer begins with a renegade cell that divides uncontrollably, gradually forming a tumour. A tumour turns malignant or cancerous when its cells invade other tissues. Now, some tumours grow quickly, where others may take up to 10 years before they are detected. To test Conchita for cancer, a doctor used a thin needle to take a tissue sample from a lump. It contained cancer cells, so she had surgery to remove the tumour and the surrounding breast tissue and to determine the tumour's stage, that is, size, type and spread, and grade, or speed of growth. After surgery, many patients have additional treatments aimed at preventing the recurrence of the spread of cancer. Now, cancer cells can break away from a tumour, travel through the bloodstream or the lymphatic system and start growing again. The spread or metastasis of cancer to vital organs and tissues, the brain, the liver, the bone marrow or the lungs, is what turns the disease so deadly. Conchita underwent both radiation and chemotherapy to destroy cancer cells around the original site and throughout the rest of her body. Since her form of cancer fed on estrogen and also underwent anti-hormonal therapy to hinder the growth of new cancers. Advances in breast cancer treatment offer other options to patients according to their age, health, cancer history and the individual cancer. For instance, in the case of a woman named Arlette, tests revealed her cancer before it spread beyond the milk duct, so she had a lumpectomy, which saved her breast. Alice had chemotherapy before surgery to shrink her tumour. Janice's surgeon removed the tumour and only the sentinel lymph node the first node into which the fluid from the tumour drains. Now, since it held no cancer cells, additional nodes were left intact. This reduced Janice's risk of lymphedema and uncomfortable swelling of the arm that can occur when many lymph nodes are removed. Much is known about the growth of breast cancer, but the basic question continues: why and how does breast cancer start? So what are the causes? Well, the causes of breast cancer remain a puzzle. Critics say that more research is done on treatment and screening, which reap big profits, than on causes and prevention. Still, scientists have unearthed important clues. Some believe that breast cancer results from a complex, multi-step process, beginning with a faulty gene that causes cells to misbehave, to divide furiously, to invade other tissue and to evade capture by immune cells, and to launch stealthy attacks on vital organs. So where do errant genes come from? In between 5 and 10% of cases, women are born with genes that predispose them to breast cancer. But it seems that in many cases, healthy genes are damaged by outside agents, such as radiation and chemicals being among the prime suspects. Future studies may confirm these links. Another link includes the hormone estrogen, which appears to stimulate certain breast cancers. Hence, a woman's risk may be raised if she began menstruating very early in life or went into menopause later than normal, if she had a late first pregnancy or no pregnancy at all, or if she had a hormone replacement therapy. Because fat cells produce estrogen, obesity may increase risk in postmenopausal women whose ovaries have stopped producing hormones. Other risk factors include high levels of the hormone insulin and low levels of the sleep hormone melatonin, a condition often affecting night workers. Are more effective, less traumatic treatments for breast cancer on the horizon? Well, researchers are developing therapies that involve using the body's own immune system and drugs that target the molecular pathways that support cancer growth. Meanwhile, improved imaging technologies should help clinicians deliver radiation more precisely and effectively. Scientists are also fighting on other fronts, including unlocking the mystery of metastasis, outwitting chemo-resistant cancer cells, and disrupting cellular growth signals and tailoring treatment to individual tumours. Nevertheless, in today's world, disease will never be eliminated and humans will continue to die. How do we know this? Well, in Romans chapter 5 verse 12 it tells us, "That is why, just as through one man sin entered into the world and death through sin, and thus death spread to all men because they had all sinned." Only our Creator, Jehovah God, can change that sad reality. But will He? Well, the Bible answers yes. And the time will come, it says, when no resident will say, "I'm sick." Isaiah chapter 33 verse 24. What a relief that will be.